I am Kasturi Rangan, in profession by chartered accountant. We are a small family, my wife and my son, who is dedicated to BTech. We have a normal, healthy life we have been leading, all the entire family members. In November 2020, I took my wife for a normal checkup. She has been losing weight by 2-3 kgs. Just for being around 50 years, I taken her to a normal checkup, then found that she had a very high blood count. So we are not aware what is the reason behind this. So we consulted a doctor. Then I came to know when I consulted privately with what is happening. He could know it's a, they say it's CML. First I heard that word, what is CML? I don't know what is that CML. Then they say it's a leukemia. It is a type of blood cancer. Because cancer till such time we heard only in cinemas, other thing, my relatives, very rarely. None of my family members or my side or my wife's side never had this disease. Then I was very worried to hear this. Then he told it is in a, they said blast stage. So it is, you have to take a treatment immediately. Otherwise the lifespan will be reduced maybe about 8 months to 1 year only she can survive. I really got deep shock because I don't know how to proceed further. What to do? I never come across such situation till such time in my life. So I didn't reveal this to my wife because she'll be too worried. She never went to any hospital after her delivery of my son. Through my friend, I referred one doctor. With him, we taken the initial treatment about couple of months time. Then I told my wife it is a normal treatment only. Come just for a healthy checkup. You have to take some tablets. They were referred. Though I am myself, my brother only aware what is happening. Then after 3 months time, again we come to know the situation. Boy and large same. Though there is a little bit subsidization is there, but there is no much improvement in the disease stage. Then my client is there, my friend, Dr. Dilip, he is a nephrologist, he is working in Yashoda. He told me, we can consult my colleague, Dr. Ganesh. You come and see. I told at that time my wife was not aware what is the real problem for her. It's almost about 3 months time. November diagnosed, it is now March 21. Then I taken appointment with Dr. Ganesh. I informed Dr. Ganesh the entire situation that she is not aware. Then she told, no, you come with your wife, don't come alone. Then somehow I convinced her to bring to the hospital. The first time she came to know something is serious for her. Otherwise, because seeing the hospital atmosphere and the slides are happening about the cancer. Then Dr. Ganesh informed me the stage is like this. You have to go in. He informed me what is to be done. Then we came to the first time what is BMT, how this can be taken. He explained me in private. Then subsequently told it's a stage you can go for a BMT. Then that is in sometime in March 21. Then I informed my wife slowly what is there, because in my parents are all, both her parents and my parents are very old. There is nobody is there in the family to take care of her immediately. If anything, that was the worry. Then moment I revealed her, she started worrying what to do, what will happen, whether I will work or not, who will take care of everybody, who will do all this work. As a normal mother, she used to worry what to do next. We convinced her, taken 15 days. Dr. Ganesh helped me in how to convince her. I brought her to a couple of times to the hospital, went on testing. Then eventually in May 2nd week, we got her admitted. So she was, by nature, since she never went to hospital, she was so timid, how to do, what is going to happen, so much of anxiety was there in her mind. But once she admitted to the hospital, I was stayed along with her 3 weeks time. But entire thing was changed. That because of the team, I have to say my thanks to Dr. Ganesh. You taken care of like your own family member. Entire team, entire BMT team, moment I admitted, she never felt, she felt at home. Because the entire process of 3 weeks, we are worried because what to do, we never went to the hospital, what will happen, who will going to help, all these things were there. But God willing, because of the medical team support, she also felt at home, she had the confidence, daily by talking, daily she gets confidence when going there, whatever worry she had, everything went off in the hospital. So she was very well cooperated in the entire 3 week period. Then we had, okay, as a treatment, we had some problems were there. Those things were taken care of timely by the entire medical team and timed by the doctor's advice. After her discharge, then post-operational treatment, post-treatment also went on very well. Every week she used to come. Then slowly as progress was good. Then after 6 months time started improving. and now she started doing all her work well. And now we look back, and years time, same time in February 21, I was deeply worried what to do, how it will happen, because nobody was ever in entire family member. What even today also, either their parent or my parent are not aware what we transpired in last 1 year. So this could happen only because of the support given by the medical team of the doctor and Yashoda's experience. We came such a difficult path in the life successfully with God's grace and support of the medical team. Of course, support of my friend, brothers, other things for that. Thank you.
నమస్తే, నా పేరు రాజేశ్వరి. నాకే బిఎంటీ హాఫ్ మ్యాచ్ ట్రాన్స్ప్లాంటేషన్ అయింది. ఒక బిగినింగ్లో ఒక 4-5 months 3 months వరకు నాకు చెప్పలేదు. ఏదో టాబ్లెట్స్ తీసుకుంటున్నాం, ఏదో ప్రాబ్లం ఉందని తెలుసు, కానీ ఇంత ప్రాబ్లం అని నాకు తెలీదు. తర్వాత ఒకసారి డాక్టర్ దగ్గర తీసుకొచ్చారు, యశోద హాస్పిటల్లో మా గణేష్ డాక్టర్ దగ్గర తీసుకొచ్చారు. ఆయన అన్నీ ఎక్స్ప్లెయిన్ చేశారు. ఆయన చేశాక కూడా భయం ఏమొచ్చిందంటే, ఇట్లా బ్లడ్ క్యాన్సర్ అంటే తర్వాత నేను ఎట్లా ఉంటాను, మళ్ళీ మా ఇంటి పని ఎట్లా చేస్తాను, ఇల్లు ఎలా చూసుకుంటాను, అండ్ ఈవెన్ కూడా ఎట్లా నడుస్తాను, డాక్టర్ సార్ నేను అన్నీ అయినాగా నడుచుకుంటూ వెళ్తానా లేకపోతే నన్ను తీసుకెళ్తారా, అలాంటి భయం, ఇంటి పని చేస్తానా, అంతేనా అయిపోయింది లైఫ్, అలా భయపడ్డాను. తర్వాత ఇంట్లో కొంచెం ఫ్యామిలీ సపోర్ట్, మా హస్బెండ్ అండ్ మా బాబు ఇద్దరు ఏం కాదు నీకు మేము ఉంటామని చెప్పారు. అన్నా కూడా ఆ ఫస్ట్ డే ఆఫ్ అడ్మిషన్ రోజు చాలా భయపడ్డాను. తర్వాత సార్ వచ్చి చాలాసేపు మాట్లాడారు, మా డాక్టర్ సార్ వచ్చి ఏం కాదు మీకేం కాదు అన్నారు. తర్వాత అంత ఉన్న భయం అంతా బిఎంటీ రోజు వరకు ఉండింది. బిఎంటీ రోజు ఒక ధైర్యం, సార్ ఒక విజిట్ చేశారు, నాకేం ప్రాబ్లం లేదని బాగా చెప్పారు సార్. అందువల్ల వాళ్ళ టీం కూడా బాగా కోఆపరేట్ చేశారు. ఎప్పుడు మానిటర్ చేస్తూ ఉంటారు, అక్కడ హాస్పిటల్లో ఉన్నప్పుడు అన్నీ మానిటర్ చేస్తూ ఉంటారు. తర్వాత అప్పుడు ఉన్న భయం అంతా పోయింది, బిఎంటీ చేశాక ముందు ఉన్న భయం అంతా పోయింది. తర్వాత ఇంటికి వెళ్ళాను. మా ఆయన అన్ని పని చేశారు. ఫస్ట్లో పని చేయలేకపోయినా వద్దన్నారు. అందువల్ల తర్వాత వీక్లీ వన్స్ చెకప్ అయింది. అప్పుడు వీక్లీ వన్స్ తర్వాత 10 days అన్నీ మెల్లగా సార్ చెప్తూనే ఉంటారు. అంతే ఏమైనా ప్రాబ్లం వస్తే కొత్త మెడిసిన్స్ ఇంట్రడ్యూస్ చేస్తారు, టాబ్లెట్స్ ఇస్తారు. అన్నిటికంటే ఎక్కువ కాన్ఫిడెన్స్ అనేది సార్ ఇచ్చింది ఫుల్. వాళ్ళ టీం, వాళ్ళ సపోర్ట్, యశోద హాస్పిటల్ టీం వల్ల నాకు ధైర్యం ఇంత వస్తుందని నేను అనుకోలేదు. ఇప్పుడు 9 monthsలో ఫుల్ కాన్ఫిడెన్స్ వచ్చింది. డెఫినెట్గా నేను అన్నీ ఇప్పుడు అంతా మా ఇంటి పని అంతా చేస్తున్నా, అందరితో మాట్లాడుతున్నా, బయటికి వెళ్ళడానికి భయం లేదు. చాలా భయపడతాను, ఎలా ఉంటామో ఏమో, లైఫ్ ఎట్లా లీడ్ చేస్తాను. బట్ ఎవ్రీథింగ్ బికాస్ ఆఫ్ సార్ సపోర్ట్ అండ్ టీమ్ సపోర్ట్ ఇప్పుడు చాలా బాగున్నా, మా ఇంటి పని అంతా చేస్తున్నా. సో ఒక ధైర్యం వచ్చేసింది.
Hello friends, today we are again witnessing another great day with a very important milestone in the history of bone marrow transplant at Yashoda group of hospitals. One of our very close patients, Mrs. Rajeshwari garu, she has fought her life-threatening blood cancer, CML blast crisis, with timely bone marrow transplant, half-match bone marrow transplant with her son as her donor. Now she has crossed 9.5 months post half-match bone marrow transplant. So in any allogeneic bone marrow transplant, there are 3 phases. The first phase is when the patient is admitted and undergoes the bone marrow transplant till the time the normal blood count improves, and that is the first stage, that is called as engraftment stage. So 1 to 1.5 months first stage. Second stage is up to 6 months to 9 months till the time the patient's immunity comes back to normal, and the third stage is from 9 months to 5 years of time post bone marrow transplant, during which time the chance that there are 3 important risks: the risk of the stem cells attacking on the patient's body, that is graft versus host disease, then rare opportunistic infections because of little impaired immunity, and the third stage is always there is the risk of cancer coming back up to 5 years. So 5 years survival after bone marrow transplant is called as complete cure from the blood cancer. So 5 years survival is operational cure in any oncology. So I am very proud, we are witnessing the successful recovery of Rajeshwari garu in the second phase. We will continue monitoring her every month with blood test, and we will continue witnessing her successful journey, her triumph, against the deadly blood cancer. Throughout this journey, she has been supported immensely by her family members, and we are very proud to be associated to witness another milestone, another success story in the history of blood cancers and bone marrow transplant. So, Mrs. Rajeshwari Garu's success story again, time and again emphasizes one important fact in the history of blood cancer. So, blood cancers is not the end of the road, is not end of the life. In fact, it is a way of living a new life, totally new life. It pushes someone to live life with more confidence, with more dedication, and Rajeshwari Garu has proven that, as she clearly mentioned, that her confidence, her support from family and medical team made her come out of this all the obstacles and successfully win the battle against the blood cancer through half match bone marrow transplant. She has crossed 50 years of age. Even at age 50, 60, 65, the bone marrow transplant can be completely successful and can give us a completely normal, healthy life to all the patients suffering with this kind of blood cancer. So, blood cancer is not the end of the road. It is in fact a new life which needs lot of confidence and determination, like Rajeshwari Garu has proven fighting her blood cancer. Thank you.